गुड इवनिंग, खुशामदीद, नमस्ते। मैं आपकी होस्ट और दोस्त डॉक्टर विनी कांट्रू। मैं हर थर्सडे को आपसे मिलती हूँ इसी प्रोग्राम में जिसका नाम डॉक्टर केके's मेड टॉक्स है। आई मीट यू एवरी थर्सडे ऑन दिस शो विच इज़ द डॉक्टर केके's मेड टॉक्स. This is an awareness program which is run almost every day to cater to the needs of healthcare information which is lacking at many of these sectors. This endeavor was started by Dr. K.K. Agarwal, who, with his gracious presence and the knowledge, used to spread a lot of medical information, relevant medical information to the masses. From therein, we are carrying forward the legacy of this huge platform, which caters to a large number of people across India as well as abroad. सो आज भी हम आपसे मिलने आए हैं, कुछ इम्पोर्टेंट डिस्कस करने आए हैं. हमारा आज का 994th एपिसोड है डॉक्टर केके's मेड टॉक्स का. बहुत सारी बातें करेंगे हम, लेकिन पहले चलते हैं द हेडलाइंस ऑफ द डे पे. So, according to the recent statistics, ऐसा देखा गया है 20 to 30% of the population of India is projected to be suffering from at least one allergic diseases. Now, allergic diseases जो होती हैं वो हमारे स्किन के अंदर, हमारी गट के अंदर, हमारी एयरवे के अंदर, जो हमारी सांस लेने की नली है उसके म्यूकोजा के अंदर, और अपर एयरवे के अंदर जिसमें कि आपका लेरिंग्स और पोस्टीरियर फेरिंग्स और नोज का एरिया और एयर के कई एरियाज आते हैं. ये सारे कुछ एरियाज अफेक्ट हो सकते हैं. There is a huge pool of allergic diseases, and this has been seen to be increasing in the recent years, especially in children. The cause and all the risk factors are in front of us. हम सब देखते हैं कि कितना पोल्यूशन लेवल बढ़ गया है, और यही ट्रिगर्स होते हैं जो कि हमारे अंदर इन्फ्लेमेशन का माहौल प्रोड्यूस करते हैं. Climate change triggers the increase in pollen allergy prevalence. Now, we all know that climate change causes a lot of problems, and it is leading to premature, change of seasons. जो season पहले इतना गर्म नहीं रहता था, वो चेंज होके हमने देखा है कई बार गर्मी बहुत ज़्यादा जल्दी पड़ जाती है, या ठंड भी बहुत ज़्यादा एक्सट्रीम हो जाती है. इसी तरीके से देखा गया है जो पॉलन का सीजन है वो भी अफेक्ट होता है. पॉलन के सीजन में हम सब जानते हैं कि एलर्जिक डिजीजेस जो हैं वो बढ़ जाती हैं. रिसर्च फाइंड्स फूड लेबलिंग कंसर्न स्टिल अ बिग इशू फॉर कंज्यूमर्स विद एलर्जीज. फूड की जो लेबलिंग है वो बहुत ही इंपॉर्टेंट होती है, क्योंकि लेबल पे जितने भी इंग्रेडिएंट्स लिखे जाते हैं वो ही पढ़ने के बाद एलर्जिक लोग ये डिसाइड करते हैं कि हम क्या खा सकते हैं और क्या नहीं. आप बोलेंगे कि एक छोटे मोटे फूड को खाने से भला क्या हो सकता है ना. कुछ लोग ऐसे होते हैं, देयर आर फ्यू पीपल who can get anaphylaxis, which is an extreme form of allergic reaction, the reaction of your body to any kind of allergic antigen which triggers such a kind of reaction in the body, so that there is drop in the blood pressure, there is problem in breathing, a person can have choking, and that is why this is known as anaphylaxis. इसको प्रिवेंट करने के लिए ये जानना बहुत ज़रूरी है इन लोगों को कि उस फूड का कंटेंट क्या है. अब रिसर्च के द्वारा ये देखा गया है कि लेबलिंग हमेशा प्रॉपर नहीं होती है, और इसको एडवोकेट करना जो एनफोर्समेंट एजेंसीज है उनका काम है. तो ये मेटिकुलसली होना चाहिए, क्योंकि ये जानलेवा भी हो सकता है उन लोगों के लिए जिन लोगों को एलर्जीज होती हैं. And Toad launches the probiotic for the management of nasal allergies. नेजल एलर्जीज और बाकी एलर्जीज के बारे में हम आगे भी बात करेंगे हमारे स्पेशल गेस्ट के साथ, और जानेंगे कि ये नई चीज़ें जो आ रही हैं वो क्या हैं. The FDA has accepted a supplemental biologic application for the use of omalizumab to reduce the allergic reactions due to accidental exposure. यानी जब किसी का एक्सीडेंटल एक्सपोजर होता है किसी भी एलर्जन के साथ, क्या उसको बायोलॉजिकल थेरेपी दी जा सकती है या नहीं, इसके बारे में भी हम जानेंगे. चलते हैं आज के टॉपिक ऑफ द डे पे. Emerging trends in allergy management. When we have known that there is increase in the amount of allergies, be it any nasal allergy, be it throat allergy, posterior pharyngeal allergies, your ear, nose, and throat area, lung allergies, as well as food allergies and extreme forms of allergy. There are a lot of allergic reactions which happen, and now we have a lot of medication to offer in the allergy kitty. So that is why we have chosen this topic today. What are the emerging trends in allergy management? I have a very special guest today. I take pride in introducing our very special guest today, Dr. Surya Ajay Rao.
Good evening. Hi. Thank you for the opportunity.
Good evening, Dr. Surya, and very warm welcome to you here. Let me tell you about Dr. Surya. She is a dedicated ear, nose, and throat and head and neck surgeon driven by the special passion for allergic diagnosis and management. With a foundation in medicine from Government Kilpauk Medical College, Dr. Rao pursued post graduation in ENT and head and neck surgery from Adichuna Changari Institute of Medical Sciences, which is in Mandya, Karnataka. Deepening her expertise in allergic diseases, she obtained a diploma in allergy and asthma from the CMC Hospital and College in Vellore in collaboration with International Asthma Services, Colorado, United States of America. Dr. Rao's commitment to providing comprehensive care in ear, nose, throat, and allergic diseases underscores her dedication to patient well being. A very warm welcome again, Dr. Rao.
Thank you.
So today we are going to discuss about a very important topic. What are the new trends in allergic management? Now, how to start it over, I think we should be talking about what are these allergic diseases and what all manifestations do we see in people of various age groups.
So, allergic diseases, it manifests, as you told in the introduction, it can be a problem with the nose. It can be allergic rhinitis. In allergic rhinitis itself, there can be runners and blockers. That means people with running nose and sneezing as a main complaint, or people with nasal congestion or nose block as the main complaint. Those people will not even realize that it is because of allergy. They'll not, because there's no sneezing or runny nose, they'll not think it is because of allergy. In the throat, because of the post-nasal drip or allergic pharyngitis, there will be throat irritation. And of course, allergic bronchitis or severe stage, it can be asthma. And there are people who have food allergies and skin allergies. So these are the urticaria or allergic rashes with itching. So these are the most common manifestations I see as allergy. Of course, there are some people who doesn't have any symptom of allergy, but occasionally they get um, allergic anaphylaxis due to some identifiable or unidentifiable substances. So these are the very rare occurrences of allergy.
Right. So do they occur in people of all age groups or certain age groups are very susceptible? क्या ये सब लोगों में होती है या फिर कुछ ही लोग हैं, कुछ ही एज ग्रुप के लोग हैं जिनमें हम एलर्जिक मैनिफेस्टेशंस पाते हैं?
Allergic manifestations can happen in any age group, but because you asked this question, I would like to tell about atopic march, where in the children, in the kids, more of we see more of eczemas and rashes. In the adolescent age group, it can progress to rhinitis and asthma in the elder population. But that doesn't mean that asthma doesn't happen in kids. But most commonly, the allergic march, as the severity increases, more asthma is seen in the elderly.
Rightly so. And when we talk of allergies, especially ear, nose, and throat allergies, what all manifestations do these people have most commonly? And starting from a range, do are these mild kind of problems, or they could land up in severe problem also?
If you ask me specifically ear, nose, and throat, sneezing and runny nose is not the most common manifestation I see in my clinical practice. Most common is post nasal drip. they keep on getting dry cough or the hawking sensation, frequent clearing of the throat. Like this is the only thing which happens for the patient. So the patient will be very much worried about the cough. So this is the most common manifestation of allergy in the adults, in the ENT side. Yeah, second most common is allergic runny nose and sneezing. But of course, for that, the patient will be having some medicines and the symptoms will be well under control. So this post nasal drip and sinusitis is it's our duty to identify that and treat the patient accordingly.
Most definitely, ma'am. So, we are talking here today about the latest medication and management in terms of what we have to offer our patients in case of allergies. So, let's go on to this topic, that what do we have new in the kitty?
So so previously, the allergies were taken as like it's just a bunch of diseases, and for that we used to give antihistamines. If it was very severe, we used to give steroids, and that was the just a uniform prescription for all the patients. So now that precision management has come, we the latest trend is allergen identification. So that is the only thing which can give a at least a bit more permanent cure to the patient rather than giving antihistamines. Yes, antihistamines have very good role in the management of allergy as a temporary relief, but I would suggest we should first grade the symptoms of allergy. Like for example, in our ENT, we have a classification for allergic rhinitis, like mild, intermittent, um, perennial allergy, severe allergy. So in patients who are suffering, even after taking antihistamines, there are recurrences. Even after taking nasal sprays, there are recurrences. And patients with long-lasting symptoms, we should go for allergic skin prick testings, allergen identification. There are two methods for allergen identification. One is allergen skin prick test, and another one is immunocap, that is a blood test to find out the serum specific IgE levels, to find out the IgE levels for each allergen in the blood. So these tests can be carried out and allergen identification can be done. So after allergen identification, we should go for a second history. We should talk to the patient again, find out whether the allergens which are identified are really significant allergens. So significant allergen means whether first is the allergen should be positive for the patient. Second, there should be a daily exposure, and the exposure should not be should be unavoidable exposure, and the patient should recognize from the clinical features that after the exposure of the allergen, there should be a clinical symptom. So these are the four criteria which we should satisfy, and those patients can be started on immunotherapies, which are of two types of immunotherapy. That is sublingual immunotherapy and subcutaneous. So sublingual is in the form of drops, and in outside India, it is even available as tablets. And subcutaneous is in the form of injections, which the patient will have to come to the doctor's office and take for a long period of time, maybe 3 years or 5 years. So this is the only permanent cure which we can give for unavoidable allergens. So unavoidable allergens, what I mean is house dust mites. House dust mites which are usually seen in clothes. So clothes are something which we cannot avoid, present everywhere. The skills, the mattress, everywhere. So such people will specifically come and tell, my child will get up at night, midnight at 3 a.m., 12 a.m. She will start sneezing. They'll have early morning sneezing. So all these clinical factors we can put together, we can find out that this allergy is really due to house allergy. We start on immunotherapy. So the dependence, we can take off these patients from the other temporary relief for allergy like inhalers, nasal sprays, antihistamines. The dependence on the medicines and it increases the quality of life of the patient. And regarding the avoidable allergens, um, what I tell my patients is everybody will be telling them, I had Bengen today, I got allergy, you also don't have Bengen. So These allergic people, they tend to avoid a lot of things just by hearsay. So by proper allergen identification, we can tell the patient what they should avoid, what they need not avoid, what is the real cause of this allergy. So that also increases the quality of health.
Right. So, when we talk about allergen identification, now obviously there would be the tests involved. जब हम बात करते हैं allergen avoidance की, तो हम ज़रूर बातें करेंगे उस टेस्ट की जिससे हम आइडेंटिफाई करते हैं कि किस एलर्जन से एक पेशेंट को एलर्जी होती है, which is the problem creating antigen, and we have to identify it. Now, let's talk about more about these tests. Are these available in India? How expensive are they? What variety of tests do we have in the offering? And are these reliable all the time?
See, allergen identification test, as I told you, it is two types. One is skin prick test. उसमें क्या होता है? We apply the allergen. So we have extracts. Yeah, it is very well available in India. So we have extracts in small bottles of each allergen. For example, for food allergy, we have extracts of milk, we have cheese, paneer, banana, fish, egg, everything we have separately. So we put these medicines drop by drop in the hand, and with a very small stillet, with a needle, small scratches are made in the skin over the drop, so that the medicine goes under the skin. So that's where the allergic reaction can be tested. Then we make the patient wait for 15 to 20 minutes. In that waiting time, suppose there is allergy to banana, wherever I put the banana extract, there will be a small mosquito bite-like reaction called wheel and flare reaction. So depending on the size of the swelling, there will be some itching also. Depending on the size of the swelling, I can find out what is the degree of the allergy, whether there is allergy or not. So that's how this test works. That is the skin prick test. So this is the gold standard for allergy testing, because there is no, it doesn't go wrong, because the skin is, our body is answering the test. That is point number one. So it is very accurate. There is no false positives. The cost is also very less, depending on the number of allergens tested. The consultants, I think, can charge from 2,000 to 5,000. That is what I have heard. And accuracy is more. And one more thing is, the patient is seeing the reaction in the hand. So the compliance of the patient to the treatment is also very good in case of skin prick test. One advantage of skin prick test is in certain patients who cannot stop anti-allergy medicines, or who cannot stop certain medicines like sleeping tablets or anti-epileptic tablets and all. Such patients, we cannot do the skin prick test. We have to stop such medicines for a minimum of 3 days before doing the testing. So that is one disadvantage of the skin prick test. The second one is the immunocap or specific IgE testing. So in this test is usually done in labs. It is costlier than the skin prick test. It can be done in any patients, irrespective of what all medicines they are taking. So since such patients where they cannot stop the medicines, the second choice will be the immunocap. But there are chances of false positives. That means the patient will not be allergic to a particular thing, but it will show that it is allergic, because the the immunocap, that is the blood test, it just detect the presence of that IgE in the blood. That's it. But the skin prick test, it tests whether that IgE is really working or not. So only just presence of IgE is not, we are not bothered about that. The IgE should be working and creating allergy for the patient. It should be attached to the mast cell. So it, skin prick test, it detects the bound IgE. The other one, the immunocap, detects the serum IgE. So that's why it gets more of false positives. So that is always a second option, but it can be done. So these are the ways where we do the allergen.
Right. So after we identify certain allergens, for example, there would be some food allergens. Do we ask the patient to stop these foods altogether? And regarding the slit therapy, the sublingual and the subcutaneous therapy, Tell us more about this. How many sessions are required, and how long does it take for the patients to get better usually?
So, so after the allergen identification, we classify the allergens as avoidable and unavoidable allergens. So, avoidable allergens, we ask the patient to avoid. We usually don't give immunotherapy for avoidable allergens. For example, food, pets, such things, house dust, spider dust. So all these things can be insects. All these things can be easily avoided by taking precautions and lifestyle modifications. Unavoidable allergens like pollens, house dust mites, which we cannot see with the naked eye and which is there everywhere. We cannot ask the patient not to inhale pollens. In such case, patients we give immunotherapy. There is no strict rule that we should not give immunotherapy for unavoidable allergens. There are certain rare cases where, suppose a South Indian is allergic to rice, definitely that patient will want immunotherapy for that. So, in such cases, on patient's request, a person who has 6 dogs who are crazy about dogs, and if that patient has allergy, they will want to take immunotherapy more than getting rid of the dog. So, in such cases, we can help the patients by giving immunotherapy. Unavoidable allergens, definitely we go for immunotherapy. And before going for immunotherapy, as I told you, we have to satisfy the 4 criteria. That is, it should be positive, it should be present in the patient's surrounding, and that it should be unavoidable, and it should cause a clinical symptom for the patient. The symptoms and the allergen should match. So in such case, and one more thing is, there should not be any polysensitization in the patient. That means certain patients with, for example, heart patients who are on aspirin, or patients who has taken a contrast CT scan or something, they would have got hypersensitivity triggered. So in such cases, there will be polysensitivity, sensitization. That means the patient will be allergic to some 10 pollens, so much dust, so many food allergens, and one of that will be house dust mite. So in such cases, we will not give immunotherapy because it doesn't make a difference, doesn't make a meaning. So in it should be it is more useful in case of monosensitized patients.
Right.
So
Where
these
we
are the immunotherapy. Yeah. So these are the criteria. And comparing sublingual and subcutaneous injections, efficacy wise, subcutaneous is more efficient, but compliance wise, if we ask a patient to come to the working woman or working man, come to the hospital every week, twice a week, take the injection, wait for half an hour and go, that is, they will not agree to for that. So sublingual is more practical. They can keep it in the store it in the fridge. They can take it in the comfort of their home. So complaints wise, that is better. I have not found so much difference in efficacy between subcutaneous and sublingual. Sublingual works well, so I practice sublingual.
right, ma'am. So, as we talk about sublingual and subcutaneous therapy, now we in India do know that when we have qualified persons sitting on one end, on the other hand, we do have many number of quacks sitting in. So, let's talk about the adverse effects which can arise due to slit or due to subcutaneous immunotherapy. What should our audience be careful about when they choose their centers for these therapies?
The center should be a center with a qualified pulmonologist or ENT doctor, allergy specialist. So somebody who is specialized in allergy. So, and what I usually tell my patients is, the in such centers, the allergy test should be done by a doctor. So there are so many centers across India where allergy test is done by lab workers. So I have found allergy test patients come with 2 or 3 allergy tests, and these 3 allergy tests will be having different informations and lot of false positives when it is done by untrained people. Because one thing is, there can be many instances when we do a full allergy test in a fully symptomatic patient. we will get a negative result. That can be due to just non-allergic rhinitis, non-eosinophilic type of asthma. Uh, all these things can be there. So some lab workers, they will not be accepting that. So there can be false positive. So before I start an immunotherapy for a patient, I always repeat it by myself. I repeat the test by myself. So please go to a recognized allergy center where the doctor does the allergy testing and measure the reaction by themselves, and confirm the test and do the start the and before starting the immunotherapy, you should take a second history with the patient. Talk to them about what is happening in immunotherapy. Immunotherapy is not any steroids or any medicine. It contains just the same allergen which they are allergic to. So which we introduce in small increasing doses, so that the patient gets desensitized to that. Allergic reaction wise, side effects wise, sublingual is very safe. Subcutaneous, yes, there are chances of immediate side effects. So that's why always subcutaneous injections are taken in a hospital, in a doctor's office setup. And after the injection, the patient is supposed to wait there for half an hour to 1 hour. Sublingual, it is very safe to take at home, because the initial starting dose of sublingual immunotherapy which we give will be lesser than the daily exposure of the patient to that particular allergen. So the pickup is very gradual. So sublingual immunotherapy is safe.
Right.
No other
Yeah.
side effects. It's not a steroid or anything.
Right. We have many people today logged into the program. We have Nandlal Shardaji. He's a doctor himself, so he always comes to our program. We thank you, Dr. Shardaji, for connecting to us every Thursday. I'll take up certain questions also. Before that, let's say good evening to all. They are sending their best wishes to you, Dr. Rao, M.A. Lamba, Bimla Kapoor, Ramesh Palji, Panwar, Namaste आपको भी. मनप्रीत सिंह जी यहाँ पे आई हैं and she has expressed her thanks to Dr. K.K. Agarwal for all this legacy which he has given us. Aruna Tyagi ji is here. Ali Nazakat, Ashok Luthra, Shubhlata Chatwal ji, Anamika, and let's go to some of the questions which we can take at the moment, and then we go on to the other therapies. Dr. Sharda is asking us, will anti-allergic medication affect immunity in any way?
No, anti-allergic medications will not affect immunity. That is two separate parallel routes of immunity. This immunity is different, allergy is different. Immunity to infection is different, allergy is different. It's not going to.
Right. He again is asking one of the question, and rather he's giving one of the comments that contact dermatitis during Holi to the color which we use. And in Navratri, the maybe the ornaments which are there, the nickel ornaments he might be talking about, they do cause a lot of contact dermatitis, which many people don't come to know till they have black patches around the skin. So let's talk about that also.
So that is not actually allergy. So that is dermatitis. That is just the irritation of the skin to that particular substance. So that cannot be checked by a allergy skin prick test. Another test which can be used to check that is called a patch test. So this patch test, there are patch testing kits are available. So usually it is done by dermatologist. So what happens is it has all the irritants like as I told me, nickel, certain perfume ingredients, and all these patches are there. It is the patient is allowed to go home after 48 hours. He has to come back. They will remove the patch and see the measurement of the reaction if there is any. So that is called the patch test. So
Right.
that will help him to find out the irritation, dermatitis cause.
So Mr. Mukesh is asking one of the questions: for how many days can we safely give or advise the prescription of steroid nasal sprays?
So steroid nasal sprays is, as far as I think, it is far safer than giving Montelukast, antihistamines and all, because the bioavailability of a common steroid nasal spray like fluticasone and all is 0.01%. So it is very very safe to use. We use it for 2 to 3 months continuously, irrespective of the patient, whether the patient has symptom or not. That is the minimum time which we use the steroid nasal sprays, because it takes that much time for the hypersensitivity to come down and the sinuses to get cleared. And usually what I tell is stop after 3 months, and whenever there is an issue, they can use it for a minimum of 5 days, SOS. Because that 5 days is also very important, because the full action of the onset of action of steroid nasal sprays happens in 3 days. So this, there are some patients who use on and off steroid nasal sprays. Today night you have a symptom, you use it off. So that is not, the full efficacy doesn't come. So whenever they use it for 5 days. So they will have a longer time of remission.
Right. Muhammad Nadeem ji is here with us. He's asking, I'm an allergic patient. I have respiratory allergies. My age is 24. I am getting frequent infections, such as 2 to 3 infections per month. And I have to take antibiotic courses 2 times a month. I'm also taking fexofenadine 120, Montelukast 10, and steroid nasal spray. Um, Most likely he's trying to say that his allergies are not getting better, though he has written that he's getting rheumatoid arthritis as well, but I don't think there is a connection between allergic rhinitis and rheumatoid arthritis. So he's asking about his problem. His age is about 24 years.
He has to first evaluate his sinuses and chest, whether there is any reservoir of infection there. And a temporary treatment can be started depending on the findings. If there are patients who have chronic sinus mucus collection in the sinus. So whatever, how much ever antibiotic you take, unless we clear the sinuses, not even by steroid nasal spray. Sometimes sinus washes will be required. Saline washes will be required to clear the sinuses. Then only the frequent infections will come down. That post-nasal drip and frequent infections. Unless you clear the sinus, the drip finally it can go to the lungs. It can keep infecting the lungs. So this should be taken care of. And did he mention how long he has been having the symptoms?
No, he hasn't mentioned.
If it is a longer duration, then allergy testing can be done.
Right. Mohammad Nadeem ji, I think you should be meeting either an ENT specialist or a pulmonologist, because from the face value of it, what you are trying to say is that you might be having joint pains also. So we have a lot of vasculitis conditions where the nose area is involved and there is frequent crusting of the nose, blockage of the nose, wherein an ENT person can also suggest you nasal biopsies. So this only comes if we take detailed history and examine you. So I think you need proper evaluation, and then we can come to a diagnosis that what is the exact problem. In addition, you will also require some investigation. So do get in touch with a good ENT specialist or a pulmonologist in your area. Ramesh Palji Panwar is asking about ezilastin and fluticasone combination nasal sprays. So possibly he wants to know what is the advantage of this combination over the individual medication.
Azilastin is a local antihistamine, so it gives relief within half an hour. So that is more useful for patients who have more sneezing and runny nose. So usually I give fluticasone azilastin combination for runners, the one with sneezing and runny nose as the main complaint. So it helps them a lot.
Right,
For blockers, just steroid nasal sprays.
right, ma'am. So let's move forward in our discussion. We have known about slit therapy, we have known about SCIT therapy. what more do we have to offer in the newer treatments or management therapies in case of allergic problems?
The next treatment, what I usually don't practice that. Usually, pulmonologist will be more doing it more. Will be the
Biologics,
monoclonal antibodies. So we
right?
have to give injections. But from my personal experiences, because of the cost, the patients they think a lot before going for
Right.
that.
So let me elaborate a little bit about the biologics. These are medications which are actually antibodies which are directed against certain forms of, antibodies, IgE, or the cells forming these IgE, or the receptors where these IgE act in your body. These are the biological therapies which are given in subcutaneous form. They are either weekly injections or they are monthly injections to block these IgE receptors or the IgE immunity, which acts in case of allergic people. Now, there is a catch here. This therapy is not for everybody who is having allergy. It is only for people who have been given adequate prescription and prevention therapies previously, and still they are not getting controlled. They have severe kind of problems. All therapies have been tried and they have been compliant to their therapy, especially in asthma. We see most of the time the doctor will prescribe you inhalers. However, the technique of taking the inhaler might not be correct, so you are not getting better. So that is why it is very, very important how we choose these therapies. So these are the therapies which are given subcutaneously. Insurance usually at the moment doesn't cover it. These are, as told by Dr. Rao, these are a little bit expensive, but those who have severe kind of problem in them, they range from starting the therapy for about a year minimum to 2 years, and then these people sometimes do get a regression in their problem. So this is about the biological therapy. So, Manpreet Singh ji is asking, can we cure allergy, specifically sinusitis and rhinitis? They mean to say, can we completely eradicate from our body? This is a
First,
very common question which comes in from every patient of allergy.
yeah. Um, if we can, I will not tell that we cannot cure allergy. There are so many patients who have got very good recovery from the allergy, but this there are a lot of criteria, there are a lot of ifs and buts. So as I told you first, whether the it is due to allergy or not. If it is hypersensitivity with a long, with a 3 or 4 months medication, there are a lot of patients who come the next year and tell me I am completely cured. In case of allergy also, if it is an avoidable allergy, unavoidable allergy, avoidable allergy, the patient whether she is really avoiding the allergens, that is also the complaints of the patient. Whether, as I told you, whether it is polysensitization or monosensitization, and the complaints of the patients to the immunotherapy. There are patients who were really addicted to inhalers, and now I have taken them off inhalers after giving immunotherapy. So it is curable. But if you ask me 100%, that depends. I can tell that after seeing the patient.
Right. So we have another question here from Mukesh ji. He's asking about newer oral potent antihistaminic in idiopathic urticaria.
Newer
Something about the newer oral potent antihistamine medications.
oral potent antihistamine medication. So I think he wants to talk about the non-sedative ones, the ones like Bilastin and all.
Right.
Bilastin, yes, it that I think that's he means about that only. The first generation antihistamines, they are very potent, very efficient, but the sedation is also too much. The newer ones like fexofenadine Belastin and all. Potency wise, I think it is good and non-sedative.
राइट, सो देयर आर न्यूअर मेडिकेशंस, कुछ नई मेडिकेशंस आई हैं मार्केट में जो बिलास्टिन के नाम से आती हैं, और ये काफ़ी पोटेंट है, नॉन सिडेटिंग है, यानी कि इनसे नींद की प्रॉब्लम जो है, जो एक एक आफ्टर इफेक्ट या साइड इफेक्ट जिसको कहा जाता है मेडिकेशन का, वो हो सकता है, इसमें कम पाया जाता है। और पोटेंसी इसमें पिछले जो एंटी एलर्जिक्स आते हैं उससे ज़्यादा पाई गई है। तो कुछ ये नई चीज़ें मार्केट में हैं एलर्जी को केटर करने के लिए, लेकिन जैसे डॉक्टर राव ने भी बताया कि ये बहुत ज़रूरी है कि जो एलर्जन आप जो अवॉइड कर सकते हैं उसे ज़रूर अवॉइड करें, क्योंकि यदि आप उसको अवॉइड कर लेते हैं तो आपका काम जो है 90% हो जाता है, दवा की रिक्वायरमेंट भी कम हो जाएगी और आपकी क्वालिटी ऑफ लाइफ जो है वो भी इम्प्रूव करेगी। In addition, Dr. Rao, what are the non-allopathic medication or lifestyle changes which can lead to a change in patients of allergies? What are the little precautions they can take? What can they change in their dietary factors which can lead to lesser amount of allergy formation, especially in children?
Keeping the surroundings clean and neat. The environment, if they are in polluted cities, they can wear a mask while going out. If you are suspecting house dust mite allergies, we can avoid the carpets. The cloth curtains can be changed to blinds, and the mattress thickness can be reduced. And these clothes, whatever clothes they are exposed to, can be washed in hot water, dried in direct sunlight. So direct sunlight is very important. Keep the humidity and the inside the house under control. Keeps the doors and windows open. In case of pollen allergies, we should keep the doors and windows closed. Avoid morning and early morning and evening walks. If they are going out, wear a mask, and frequent saline washes of the nose. That will also reduce the pollen allergies. Food allergy, definitely avoidance.
Right. Since you spoke about nasal washes, so let's talk something about Jal Niti. A lot of patients come and they ask about this Jal Niti, which is an age-old process which was taught in Ayurveda in India also. So does it help in any way? During COVID times also, we have seen a lot of people advocating Jal Niti to keep the virus off the nose. So what is your take on Jal Niti?
Yes, it is very, very useful in case of. First of all, it reduces the it just washes out the allergens when you take out. So first of all, the allergens get deposited in the wall of the nose. So it just washes off the allergens from the nose and the sinuses. That is use number one. Second, it breaks down the thick mucus and takes it out. So it prevents sinusitis.
Right. So Jalniti is very, very effective. It is very easy to
And
understand
nowadays
and
it has
learn.
become very easy because the pre-prepared sachets are also coming with the squeezable bottle. So
So it has become all the more easier
yes.
to understand, and there are videos available on YouTube which the patients or people can refer to and learn this to prevent these allergens, pollutions, dust, everything getting stick to their nose and causing increased amount of allergies. We had a very fruitful discussion today. I'm thankful to you, Dr. Rao, for coming here and spending your precious time with us and telling us about the newer therapies which are available, especially about allergic rhinitis and pharyngitis like conditions, which are very, very common these days. We want to honor you with small little gift, which my colleague Shrion is going to show here, a small little certificate from our end for you to keep in your already decorated your feather of what we say the cap of honors and having so many feathers in the cap. So I also want to tell my people that we will come back with a new episode with a new topic to discuss about the medical condition, which will we choose about the next time. And thank you everyone for connecting to us. And for today, this is what we have to offer. And I wish all of you a very good evening. Shabba khair, namaste, and Jai Hind. Shreyon, can we have the certificate? Thank you, ma'am. Thank you so much.
Thank you.
Bye.